According to a recent article in CNN titled Pain, Pressure, and PTSD Inside Youth Baseball's UCL Injury Crisis, what used to be a rare injury reserved for veteran professional pitchers is now happening far earlier in players' careers. So here's what's going on. The UCL sits on the inside of the elbow and helps stabilize it during the throwing motion. Classic UCL tears often led to the well known phrase Tommy John surgery in older players. But now doctors and youth coaches are reporting that UCL injuries are happening in younger and younger athletes, even high schoolers and early teens. Loss of velocity, elbow pain, popping sensations, these are all signs that shouldn't be ignored.
Hi, everybody, and welcome back to the show. What do you think of when you hear Tommy John, or who do you think of? For perspective here, I mentioned spring training is underway down in Lakeland, and a lot of us are thinking Tigers baseball, and for good reason, because Major League Baseball is going to be here before we know it, as far as the regular season is concerned, coming up here toward the end of March. But when you look at, like, let's just say the Tigers pitchers, for example, a lot of the guys on the roster have here recently or in the past undergone Tommy John surgery. Jackson Jobe, 2025, Sawyer Gibson Long, 2024, Casey Mize, 2022, Justin Verlander, 2020, Tarek Skubal back in 2016. And then even non-pitchers, position players like Jake Rogers underwent Tommy John in 21 and Riley Green in 2023. So I say all that because, if you go all the way back, I say, who do you think of? Because the procedure was first performed back in 1974 by Dr. Frank Jobe. He was the Dodgers team physician, and he performed it on Dodgers pitcher Tommy John. Okay. And the Tommy John surgery involves the UCL. That's the ulnar collateral ligament in the elbow. So is it an epidemic? Because I mentioned this goes back to, the mid 70s. But the science would back it up that it is nowadays, because it was once pretty rare in teens, but the surgery now is very common. Some studies say like 1 in 4 high school pitchers will experience a UCL related injury. Okay. And so you're looking at, it used to be, back then, obviously the Tommy John, that was like the successful portion of it, that you could come out of it. So, it's like anywhere from 12 months to 18 months recovery time. And then for position players, I mentioned like Riley Green and Jake, you're looking at more like 9 to 12 months. So like right around a year or better than a year. And then the success rate is between 80 and 90% success rate to come back from it and to continue on playing baseball. So it's not, what it used to be, which was a career-ending injury for most athletes. But the subject of today is like how it affects teens, because now they're saying teens between the ages of 15 and 19, that's the largest demographic that requires surgery. Okay. And that's where I think, for a lot of people, when we hear about Tommy John surgery, we just kind of associate that with the wear and tear on the arm for professional athletes. But then obviously a lot of guys that have it in college, like a Tarek Skubal, or before that, which is high school level kids, like I said, 15 to 19 years old. So there's just a lot to unpack. Obviously, there's a lot that, has been discussed about, Tommy John, and we're not going to get it all sorted out here today. But it is relevant to when we think of high school athletes, in particular here in the state of Michigan. Andrew Hollinshead is a member of the SportsCaster program. He's a student at Ann Arbor Pioneer High School, and he offers his commentary on the rise of Tommy John surgery for young athletes.
Hi, everyone. I'm Andrew Hollinshead, and today we're spotlighting a serious and growing issue in youth baseball: the rise of serious elbow injuries, specifically ones involving the UCL, among young pitchers. According to a recent article in CNN titled Pain, Pressure, and PTSD Inside Youth Baseball's UCL Injury Crisis, what used to be a rare injury reserved for veteran professional pitchers is now happening far earlier in players' careers. So here's what's going on. The UCL sits on the inside of the elbow and helps stabilize it during the throwing motion. Classic UCL tears often led to the well-known phrase Tommy John surgery in older players. But now doctors and youth coaches are reporting that UCL injuries are happening in younger and younger athletes, even high schoolers and early teens. Loss of velocity, elbow pain, popping sensations, these are all signs that shouldn't be ignored. Well, why is this happening? Well, there is a combination of factors. Young pitchers are throwing harder than ever, pursuing max velocity and spin rate, and athletes are specializing in one sport, baseball, instead of playing multiple sports. And last, an increased year round pitching without sufficient rest. Why does this matter for high school athletes, especially those of you who are listening in Michigan? First is workload and intensity. High school pitchers are now part of a larger trend where the pressure is on to throw harder, earlier, and consistently. One report notes the arm of a 16 or 17-year-old today looks like the arm of a 35-year-old from 20 years ago. Schools, clubs, and travel ball teams, you all need to be aware that extra innings, extra bullpens, and off-season programs all have an impact on a player's arm health. Second, the consequences are real and long-lasting. UCL injuries often require surgery, which results in a long recovery time of about 12 to 18 months, and sometimes permanently alters throwing mechanics and reduces effectiveness. Players who dream of college or even pro baseball need to understand that early heavy usage can jeopardize their future. Third, this is a chance for coaches, parents, and athletes to shift the culture. More off days, more cross training, playing other sports, more emphasis on mechanics before velocity. Those are the steps being suggested by experts. So let's bring this into the Michigan context. If you're pitching for your high school team here in southeastern Michigan or playing on a travel ball team, you've likely felt the push from club season, fall ball, winter bullpen sessions, but sports medicine professionals are warning that the UCL doesn't fully mature until later in your 20s, so pressuring it too early is asking for trouble. This isn't just about throwing fewer pitches, it's about smarter throwing, better mechanics, proper rest, and diversified athletic activity. High school coaches and trainers agree with this, that protecting the arm isn't just about throwing fewer pitches, but it's about smart throwing by using proper throwing mechanics and a followed structured plan. As we wrap up, I want you to think about this. If you're a pitcher, your arm may feel invincible right now, but long term, it's a high risk investment. The choices you make in high school can determine whether you're healthy or sidelined later on. If you were starting your high school baseball season today, whether as a pitcher, coach, or teammate, what changes would you make to your training schedule to protect your arm? Would you throw fewer innings, pick up another sport in the offseason, or focus more on mechanics instead of velocity? I'm Andrew Hollinshead, and that's been this segment of SportsCaster's Open Mic Radio.
That was Andrew Hollinshead from Ann Arbor Pioneer High School. Again, what was once considered, potential career-ending injury, now considered quite the opposite. Again, nearly 90% success rate to be able to continue to pitch after what is a lengthy rehab that could take as much as a year and a half. It is unquestionably a part of the game, but the more information that we continue to learn about injury prevention, the better it is for all parties. When we come back, what is the difference between bias and misunderstanding? Think about that. We'll get into it next here on Open Mic.